Understanding early pregnancy loss in dogs, causes, symptoms, and prevention. Early pregnancy loss in dogs. Chapter 1 Introduction. What is early pregnancy loss? Has your pregnant dog unexpectedly lost her puppies? Are you wondering what might have caused this? Pregnancy loss in dogs, also known as spontaneous abortion, can be distressing for pet owners. Today, we'll explore everything you need to know: causes, symptoms, treatment, and prevention to ensure the health of your pregnant dog. Pregnancy loss in dogs can take many forms, including embryonic death, when the pregnancy stops early before the puppies develop; fetal reabsorption, when the body absorbs undeveloped puppies; mummification, where the fetus dries up and remains inside the uterus; stillbirth, when a fully developed puppy is born lifeless; difficult birth complications, dystocia, leading to puppy loss during labor. Understanding the different types of pregnancy loss can help you recognize when veterinary intervention is needed. Chapter 2. Which dogs are at risk? Not all dogs have the same risk for pregnancy loss. Some factors make certain dogs more vulnerable. While most cases of abortion in dogs do not have a genetic basis, certain conditions may make pregnancy loss more likely. Breeds such as Borzois are at higher risk due to genetic thyroid disorders, leading to prolonged heat cycles, poor conception rates, and mid-pregnancy loss. Older dogs, particularly those over 6 years of age, are more likely to suffer from uterine diseases such as Cystic Endometrial Hyperplasia, CEH, which can lead to abortion. Exposure to infections from other animals, previous pregnancy losses, or underlying health conditions can increase the risk. If your dog falls into any of these categories, extra monitoring during pregnancy is essential. Chapter 3. Causes of early pregnancy loss. Pregnancy loss in dogs can result from infectious and non-infectious causes. Let's examine each category. Infectious causes. Infections are among the most common reasons for pregnancy loss. Bacteria, viruses, and parasites can impact both the mother and her developing puppies. Bacterial infections such as Brucella canis, E. coli, Streptococcus, Salmonella, and Campylobacter can cause abortion. Viral infections such as Canine Herpesvirus, distemper parvovirus, and canine adenovirus can lead to pregnancy complications. Protozoal infections such as Toxoplasma gondii and Neospora caninum may also contribute to pregnancy loss. If your dog has been exposed to infected animals or contaminated environments, these infections may be a concern. Non-infectious causes. Pregnancy loss can also be caused by non-infectious factors, including uterine diseases. Conditions like cystic endometrial hyperplasia, CEH, and Pyometra, pus accumulation in the uterus, can lead to pregnancy failure. Hormonal imbalances. Insufficient progesterone production, known as hypoluteoidism, can result in pregnancy loss, especially between 40 to 45 days of gestation. Medications and toxins. Exposure to chemotherapy drugs, steroids, prostaglandins, estrogens, and dopamine agonists can lead to pregnancy failure. Thyroid disorders. Conditions such as hypothyroidism may contribute to reproductive failure in some breeds. Environmental factors. Exposure to toxins, hormone-disrupting chemicals, or severe stress can negatively impact pregnancy. Fetal abnormalities, genetic or developmental defects, including lethal chromosomal abnormalities, can cause pregnancy loss. Maintaining a high-quality diet and ensuring a safe, stress-free environment can help reduce these risks. Chapter 4. Recognizing signs of pregnancy loss. Not all pregnancy losses are obvious. Some occur internally without any visible signs, while others are more apparent. Here are key symptoms to watch for. Failure to deliver or whelp on time. Delivery of recognizable fetuses or placental tissues. Decrease in abdominal size or sudden weight loss. Lack of appetite, vomiting, or diarrhea. Behavioral changes such as lethargy or depression. Vaginal discharge that contains blood or pus. Abdominal straining, discomfort, or signs of pain. Disappearance of fetal swellings previously detected by ultrasound. If you notice any of these signs, it's crucial to contact your veterinarian immediately. Chapter 5, Treatment and Management. Treatment for pregnancy loss depends on the underlying cause. Veterinary intervention is necessary to determine the best approach. For infectious cases, dogs should be isolated to prevent disease spread. Brucella canis is highly contagious and difficult to eliminate. Affected dogs may need long-term monitoring or, in severe cases, euthanasia to prevent further spread. Antibiotic therapy may be necessary if a bacterial infection is diagnosed. For hormonal and non-infectious cases, hormonal support using progesterone supplementation may help maintain pregnancy in cases of low progesterone levels. Fluids and electrolytes should be administered if the dog is dehydrated. Cage rest is often recommended for partial abortions to try to save remaining fetuses. For severe complications, spaying ovariohysterectomy is the preferred treatment for dogs with Pyometra, severe uterine infections, or those without breeding value. Every case is unique, so always consult with your veterinarian for the most appropriate treatment plan. Chapter 6, Preventing Pregnancy Loss in Dogs. Preventing pregnancy loss begins with proactive health care. Follow these guidelines to minimize risks. Test for brucellosis. Before breeding, ensure both the male and female dog are Brucella canis negative to prevent infection. Maintain vaccinations. Keeping your dog up to date on vaccines can help prevent viral infections that cause pregnancy loss. Ensure proper nutrition. Feeding a balanced diet reduces the risk of fetal abnormalities due to nutrient deficiencies. Avoid raw diets which may carry bacteria linked to pregnancy loss. Manage breeding carefully. Avoid inbreeding and prioritize genetically healthy lines. Limit stress. Provide a calm, safe environment during pregnancy. Monitor progesterone levels. If your dog has a history of pregnancy loss, checking hormone levels can help determine if supplementation is necessary. Be cautious with medications. Consult your vet before administering any drugs, as certain hormones, steroids, or antibiotics can negatively affect pregnancy. Chapter 7, Final Thoughts. Pregnancy loss in dogs can be devastating, but understanding its causes and prevention can help ensure a successful pregnancy. If you suspect an issue, consult your veterinarian immediately to determine the best course of action. By following proper health management, vaccination protocols, and breeding strategies, you can reduce the risk of pregnancy loss and support your dog in having a healthy litter. Thank you for watching. If you found this information helpful, subscribe for more pet health insights and share your experience in the comments.